March 2019, Sarah Mitchell receives the diagnosis. Stage 3 breast cancer. She's 42 years old, mother of two, works full time as a middle school teacher, has health insurance through her employer, Blue Cross Blue Shield, Gold Plan, Premium Plan. She pays $400 fee per month for family coverage. Her employer pays another $2,200. That's $1,650 per month. $19,800 per year for insurance, for the promise that if something goes wrong, she'll be covered, protected, secure. The oncologist recommends chemotherapy, 12 rounds, then radiation, then surgery, then more chemo, the standard protocol, the treatment that gives her an 80% 5-year survival rate. She agrees, starts treatment immediately. The medical bills start arriving. Each chemo session costs $15,000. Insurance covers $12,000. She owes $3,000. That's her out-of-pocket maximum per visit. 12 visits, she should owe $36,000 total. Painful but manageable. She can take a loan, can ask family for help, can survive this. But the bills keep coming. The hospital billed the chemo as outpatient. Her plan covers inpatient at 90%, outpatient at 70%, different copays, different deductibles, different out of pocket maximums. She didn't know. Nobody told her. The chemo facility was out of network. She didn't choose it. Her oncologist referred her there. It's the only facility that takes her insurance and does oncology, but it's out of network for infusion services. Uh, Another different coverage level, another different out of pocket maximum. The bills pile up. $8,000 for the first chemo session after insurance, $7,500 for the second, $9,200 for the third. By the sixth session, she's paid $52,000 out of pocket. She's depleted her savings, borrowed from her parents, took a home equity loan, and she's only halfway through treatment. The radiation hasn't started. The surgery hasn't happened. The bills will exceed $150,000 out of pocket, maybe $200,000. She can't pay it. She has cancer. She's trying to survive. And the financial stress is killing her as surely as the cancer. She calls the insurance company, explains the situation, asks why the plan isn't covering what she was promised. They explain the fine print, the terms she didn't read, the exclusions she didn't understand, the network restrictions she wasn't aware of. Everything is legal. Everything is disclosed. She just didn't understand what she was buying. And now she's dying and going bankrupt simultaneously. September 31. Sarah Mitchell files for bankruptcy. Chapter 7, she has $287,000 in medical debt. Her cancer is in remission. She survived, but she lost everything. Lost her house to foreclosure because she couldn't pay the mortgage and the medical bills. Lost her retirement savings. Lost her kids' college fund. Lost everything she built over 20 years of working and saving. The cancer didn't kill her, the healthcare system did. Financially, emotionally, completely. This is the story of the healthcare bankruptcy machine, how the United States created a system that destroys people financially for the crime of getting sick, how insurance companies collect billions in premiums and deny billions in claims, how medical debt is the leading cause of bankruptcy, how people die because they can't afford treatment, how people survive but lose everything, how a country that spends 4.5 trillion per year on healthcare has the worst outcomes in the developed world, and how you, healthy today, are one diagnosis away from financial ruin. Let me show you how the machine works, because understanding the mechanism reveals the intentionality. This isn't dysfunction, this is design. The system works exactly as intended: to extract maximum revenue while providing minimum care, to profit from sickness, to ensure that illness transfers wealth from the sick to the healthy. from patients to corporations, from the dying to the living. Start with insurance premiums. The average family pays $24,000 per year in health insurance premiums, $18,000 paid by the employer, $6,000 paid by the employee through payroll deduction. But the employer portion isn't free money. It's a part of your compensation. Your employer budgets X for your total compensation. If $18,000 goes to health insurance, that's $18,000 not going to your salary. You're paying the full $24,000. You just don't see $18,000 of it on your paycheck. $24,000 per year for a family, just for the premium. Before you use any health care, before you see a doctor, before you fill a prescription, before anything goes wrong, you're paying $24,000 per year for the privilege of having insurance that might cover some of your costs if you get sick. Now add the deductible. The average family deductible is $4,800. That's how much you pay out of pocket before insurance starts covering anything. You pay $24,000 in premiums, then you pay $4,800 in deductible. You're at $28,800 before insurance pays a dollar. If you're healthy, you never reach the deductible. You pay $24,000 for nothing. If you're sick, you pay $28,800 before coverage begins. Either way, you lose. But it doesn't stop there. After the deductible, you have coinsurance. The insurance covers 80%, you cover 20%. Sounds reasonable until you realize that medical costs are inflated beyond recognition. An MRI costs $3,000, insurance covers $2,400. You pay $600. A hospital stay costs $50,000. Insurance covers $40,000. You pay $10,000. The amounts add up quickly, devastatingly, and there's an out-of-pocket maximum, the most you should pay in a year. For the average family, it's $16,000. So the total annual cost is premium plus out-of-pocket maximum, $24,000 plus $16,000. That's $40,000 per year. For healthcare, for a family, that's more than half of median household income. How is anyone supposed to afford this? They're not. That's the point. The system is designed to be unaffordable, to force people to choose between treatment and bankruptcy, between life and financial ruin. Sarah Mitchell paid $24,000 in premiums, then paid $28,000 in out-of-pocket costs during her first year of treatment. That's $52,000. Her salary as a teacher is $55,000. She spent 95% of her gross income on health care. Impossible. So she borrowed, depleted savings, went into debt, and when the debt became unmanageable, she filed bankruptcy. The machine worked perfectly, extracted maximum revenue, provided the minimum legally required care, and transferred the financial consequences entirely to the patient. Now let's talk about claim denials, because insurance companies don't just collect premiums and pay claims. They collect premiums and deny claims, as many as possible. The business model is simple. Collect premiums from everyone. Deny claims from as many as possible. Keep the difference. Profit. The denial rate varies by company. Some deny 15% of claims. Some deny 30%. The industry average is about 20%. 1 in 5 claims is denied. Not because the claim is fraudulent, not because the treatment wasn't necessary, because the insurance company has financial incentive to deny. Every claim paid reduces profit. Every claim denied increases profit. The shareholders demand profit growth. The executives are compensated on profit growth. So claims get denied. The reasons for denial are varied and often absurd. Treatment was not pre-authorized. You didn't get permission before getting emergency treatment. You were unconscious. Didn't matter. Should have called first. Treatment was out of network. The ambulance took you to the nearest hospital. That hospital was out of network. Should have specified which hospital while having a heart attack. Treatment was not medically necessary. The insurance company's doctor, who never examined you, determined that your doctor's recommended treatment wasn't necessary. Treatment was experimental. The cutting edge treatment that might save your life isn't approved by the insurance company. Die with an approved treatment or pay out of pocket for the experimental one. Every denial is legal. Every denial is disclosed somewhere in the 200-page policy document written in legal language that nobody reads. Every denial is defensible, and every denial forces the patient to either pay out of pocket or fight the denial. Fighting takes time, takes energy, takes resources, and when you're sick, you don't have those. So most people either pay or go without treatment. The insurance company wins either way. Sarah Mitchell's insurance denied coverage for genetic testing. Her oncologist wanted to test which chemo drugs would be most effective for her specific cancer. The test cost $5,000. Insurance denied it as not medically necessary. She paid out of pocket. Later, she found out that if she had known the test results earlier, she could have avoided 4 rounds of ineffective chemo and gone straight to the treatment that worked. She spent $40,000 on chemo that didn't work because the insurance company denied a $5,000 test. She paid more, suffered more, and the insurance company saved $5,000. That's how the machine works. Let me show you the network restriction mechanism. Insurance companies negotiate with hospitals and doctors, pay our rates, or you're out of network. The rates are below market, below cost. In many cases, some doctors refuse, they go out of network. The insurance company tells patients that out of network care is covered at 50% instead of 80%, and out of network costs don't count toward your deductible or out of pocket maximum. You need a specialist. There are 3 in your city. One is in network, booked 6 months out. The other 2 are out of network, available next week. You can wait 6 months. Your condition might worsen, or you can go out of network, pay more, have the costs not count toward your maximums. Either way, you lose. The insurance company wins. They forced you into a worse doctor or forced you to pay more. Mission accomplished. And sometimes you don't even know who's in network. You go to an in-network hospital. Assume everyone there is in network. The hospital is. The surgeon is, but the anesthesiologist is out of network. Different practice, different billing. You wake up from surgery with a $15,000 bill from the anesthesiologist. Your insurance covers $4,000. You owe $11,000. You didn't choose the anesthesiologist, didn't know they were out of network, couldn't have known. But you're responsible for the bill. This is called surprise billing. It's legal, it's common, and it destroys people financially. Congress passed legislation in 22 to limit surprise billing, but the limitations have loopholes. Ground ambulances aren't covered. Certain types of care aren't covered, and enforcement is weak. Insurance companies and healthcare providers find ways around the rules. Surprise bills continue. Bankruptcies continue. The machine continues operating. Now let's talk about prescription drug costs, because this is another layer of the machine. The United States pays more for prescription drugs than any other country, 2 to 3 times more. The same drug manufactured by the same company costs $50 in Canada and $300 in the United States. Why? Because the U.S. allows pharmaceutical companies to charge whatever they want. No price controls, no negotiations, just pure profit maximization. Insulin is the most famous example. Costs $5 to manufacture, sells for $300 per vial in the United States, sells for $30 in Canada. Americans die rationing insulin because they can't afford it. Diabetics skipping doses, going into ketoacidosis, dying because a drug that's been around for 100 years costs 60 times the manufacturing cost. This is murder for profit, and it's legal, and it continues. Your insurance covers prescriptions, but with a formulary, a list of approved drugs. Your doctor prescribes drug A. It's not on the formulary. Insurance covers drug B instead. Different drug, different mechanism, different side effects. might not work as well, but it's cheaper for the insurance company. So that's what they cover. Your doctor appeals, explains why drug A is necessary. Insurance denies the appeal. You either pay $600 per month out of pocket for drug A or take drug B and hope it works. The insurance company saves money. You suffer. Standard procedure. Sarah Mitchell's cancer drugs weren't all covered. Her oncologist prescribed a targeted therapy that cost $8,000 per month. Insurance covered an older chemo drug instead, less effective, more side effects, but cheaper. She took the older drug, suffered severe side effects, had to stop working for 3 months, lost income, lost the supplemental insurance through work because she wasn't working, had to go on Cobra, had to pay the full premium herself, $2,100 per month for insurance that wasn't even covering the drugs she needed. The machine extracted money at every step, from every angle, relentlessly. Let me show you the medical bankruptcy statistics, because this isn't Sarah Mitchell's story alone. It's 530,000 families per year. Medical bills are the leading cause of bankruptcy in the United States. 6.5% of all bankruptcies have medical debt as a contributing factor. 530,000 families per year file bankruptcy due to medical costs. That's one every minute. Every minute of every day, another American family is destroyed financially by medical debt. And these aren't uninsured people. 75% of people who file medical bankruptcy have insurance. They're insured. They paid premiums. They thought they were protected. They got sick. The insurance didn't cover everything. The bills piled up. They lost everything. Insurance doesn't protect you from medical bankruptcy. It just makes medical bankruptcy slightly less likely, but not by much. The statistics are devastating. Half of Americans report difficulty paying medical bills. One-third have medical debt in collections. The average medical debt in collections is $5,000. Doesn't sound like much, but it's in collections, which means it's unpaid, which means the person can't pay it, which means they're facing wage garnishment, destroyed credit, and years of financial stress. Over 5,000 for getting sick, for having the audacity to need medical care in the wealthiest country in human history. And medical debt disproportionately affects minorities. Black Americans are twice as likely to have medical debt as white Americans. Hispanic Americans are 1.7 times as likely. The healthcare system extracts from the poor and minorities at higher rates, charges them more, provides them less coverage, denies their claims more frequently, and bankrupts them more often. This is structural racism operating through healthcare, killing and bankrupting people of color at rates that would qualify as genocide if it were intentional. And maybe it is. Now, let's talk about the uninsured, because 27 million Americans have no health insurance at all. They don't have Sarah Mitchell's problem of inadequate insurance. They have no insurance. They pay cash. Or they don't get treatment. Most don't get treatment. The uninsured delay care. They don't go to the doctor for symptoms. They wait, hope it goes away, self-medicate. By the time they seek treatment, the condition is advanced, more expensive to treat, more likely to be fatal. The uninsured die at higher rates from every treatable condition: cancer, heart disease, diabetes, kidney disease, everything, because they don't get early detection, don't get preventive care, can't afford it. And when they do seek treatment, they're charged more. Hospitals charge uninsured patients 2.5 times what they charge insured patients for the same service. Same MRI. Insured patient is billed $200. Insurance negotiated rate pays $800. Uninsured patient is billed $3,000, pays cash, or gets sent to collections, or files bankruptcy. The people with the least money are charged the most. This is reverse price discrimination. And it's standard practice. Why? Because hospitals can. Because uninsured patients have no negotiating power. No insurance company negotiating on their behalf. They pay sticker price, which is inflated to subsidize the negotiated rates that insurance companies pay. The uninsured are subsidizing the insured. The poor are subsidizing the middle class. And both are being extracted from by the hospitals and insurance companies. Everyone loses except the machine. The uninsured are disproportionately young, poor, and minority. They work jobs that don't provide insurance, gig economy, service sector, part time. They can't afford insurance on the individual market. The cheapest plan costs $400 per month with an $8,000 deductible. That's $12,800 per year before coverage starts. On a $30,000 salary, that's 43% of gross income. Impossible. So they go uninsured, roll the dice, hope nothing goes wrong, and when something goes wrong, they're destroyed financially, or they die. Often they die. Let me show you the Medicare and Medicaid dimension, because even government insurance is part of the machine. Medicare covers seniors and disabled people. Medicaid covers the very poor. Both are better than private insurance, but not good. Medicare has gaps. Part A covers hospitalization. Part B covers doctor visits. Part D covers prescriptions, but there are deductibles, co-pays, gaps in coverage. So seniors buy supplemental insurance. Medigap costs $200 to $400 per month. Medicare plus Medigap plus Part D premiums plus out-of-pocket costs totals $6,000 to $8,000 per year for a senior. On Social Security income of $1,800 per month, that's 28 to 37% of income. Seniors skip medications to afford food, skip doctor visits to afford rent, die earlier than they should because they can't afford the health care they need despite being on Medicare. Medicaid is better. No premiums, low copays, but it pays doctors so little that many doctors don't accept Medicaid patients. Finding a doctor who takes Medicaid is difficult. Finding a specialist is nearly impossible. Medicaid patients wait months for appointments, get worse care, have worse outcomes. Being on Medicaid is better than being uninsured, but not much better. You have coverage that nobody accepts, care that's barely accessible, outcomes that are barely better than no insurance at all, and Medicaid has asset tests. If you have more than $2,000 in assets, you don't qualify. This forces people into poverty to access health care. You're making $18,000 per year. You have $5,000 saved for emergencies. You get sick, need care, can't afford insurance, but can't get Medicaid because you have too much in savings. You spend down the $5,000 on medical bills, now you qualify for Medicaid, but you're broke. You had to destroy your financial security to access health care. The machine forced you to choose between savings and health. You chose health. You lost both. Now let's talk about the pharmaceutical benefit managers. PBMs. These are middlemen between insurance companies and pharmacies. They negotiate drug prices, determine formularies, decide which drugs are covered. They're supposed to reduce costs. Instead, they add costs and extract billions in profit. Here's how they work. Pharmaceutical company sells a drug to a PBM for $100. The PBM sells it to the insurance company for $120. The insurance company charges you $30 in copay. You think the drug costs $120, actually costs $100. The PBM extracted $20 for doing nothing but being a middleman, multiplied by millions of prescriptions, billions in profit, all extracted from patients and insurance companies. And PBMs create formularies that favor drugs that give them higher rebates. A drug that's more effective but gives a lower rebate gets excluded from the formulary. A drug that's less effective but gives a higher rebate gets included. Patients get worse drugs because PBMs optimize for rebates rather than outcomes. You suffer. The PBM profits, the pharmaceutical company profits. Everyone wins except the patient. The three largest PBMs control 80% of the market. CVS Caremark, Express Scripts, Optum Rx. They're owned by insurance companies. CVS owns CVS Caremark. United Health owns Optum Rx. The insurance company owns the PBM. The PBM negotiates with itself, sets the prices to maximize profit, extracts from both ends, and you pay through premiums, through copays, through denied claims and restricted formularies. The vertical integration ensures that the machine captures you at every point. You can't escape, can't negotiate, can't opt out. You're trapped. Let me show you the hospital pricing opacity. You need a procedure. You call the hospital, ask how much it costs. They can't tell you. Don't know. Depends on your insurance. Depends on the actual procedure performed. Depends on complications. Depends on 100 variables. You ask for an estimate. They give you a range, 5,000 to 50,000. Useless. You can't shop around, can't compare prices, can't make an informed decision. You're buying a product without knowing the price, agreeing to pay whatever they charge. This is the only industry where this is standard practice. Imagine buying a car without knowing the price until after you drive it off the lot. That's healthcare. The Affordable Care Act required hospitals to publish prices. They complied by publishing incomprehensible charge masters, lists of 50,000 line items with codes and prices that nobody can understand. The prices are fictional anyway. Nobody pays those prices. Insurance companies negotiate different rates. Medicare pays different rates. Medicaid pays different rates. Uninsured patients are charged different rates. The published prices are meaningless. The actual prices remain hidden until after the service is provided and the bill arrives. You're forced to make healthcare decisions in complete information darkness. The machine prefers it that way. Price transparency would allow comparison, would allow shopping around, would create competition, would reduce prices. Can't have that. Sarah Mitchell couldn't shop for cancer treatment. Her oncologist said, start chemo immediately. She started. Didn't know what it would cost. Couldn't compare facilities. Couldn't negotiate prices. Just trusted the system, and the system destroyed her financially. Now let's talk about medical debt collectors, because even after bankruptcy, the machine continues extracting. Medical debt doesn't always get discharged in bankruptcy. Some does, some doesn't. Depends on the type of debt, the timing, the bankruptcy chapter. And even discharged debt sometimes gets pursued anyway. Collectors buy discharged debt for nothing, try to collect it. Many people don't know their debt was discharged. They pay. The collectors profit from illegally collecting discharged debt. It happens millions of times per year. And medical debt collectors are aggressive. They sue, get judgments, garnish wages, seize bank accounts, put liens on houses, all for medical debt. For the crime of getting sick, you had cancer, survived, went bankrupt, discharged the debt. Now a collector bought your discharged debt and is garnishing your wages. The machine never stops, never lets go, extracts forever. Some states have protections, limits on wage garnishment, homestead exemptions, but many states don't. In those states, medical debt collectors can take everything. Your wages, your savings, your house, everything. For medical debt, for health care, you needed to survive. This is barbaric, medieval, and it's happening right now in the United States in 25. Let me show you the emergency room trap. You have a medical emergency, heart attack, car accident, fall. You call 911. The ambulance arrives, takes you to the nearest hospital. You're unconscious, can't specify which hospital. The ambulance takes you wherever you wake up. You're stable. You get the bill, $50,000. Your insurance covers $15,000. You owe $35,000. Why? The hospital was out of network. You didn't choose it. You were unconscious. Doesn't matter. You're responsible. And the ambulance bill, $3,000. Insurance covers $500. You owe $2,500. The ambulance company is out of network. Most are. They're private companies, don't contract with insurance companies, charge whatever they want. Your insurance has no negotiated rate, pays a token amount, you pay the rest. You didn't choose the ambulance, you didn't call a specific company, 911 sent whoever was available, but you're responsible for the full bill. This is emergency care in America. You're in a life-threatening situation, get treated, survive, and get billed amounts that will bankrupt you. The machine doesn't care that you were dying, doesn't care that you had no choice, doesn't care that you couldn't have done anything differently. You got care, you owe money, pay, or face collections. The machine is indifferent to circumstances, indifferent to justice, focused only on extraction. Now let's talk about the employer insurance trap. Most Americans get insurance through employers. Seems like a benefit, actually a trap. The employer chooses the insurance, chooses the plan, negotiates the coverage. You get whatever they provide. Don't like it? Too bad. Want better coverage? Pay more. Want to choose a different insurer? Can't. You're locked into whatever your employer provides. And if you lose your job, you lose your insurance immediately. You can get COBRA, continuation coverage, but you pay the full premium, $2,000 per month for family coverage on unemployment benefits of $1,600 per month. Impossible. So you go uninsured until you find a new job, which might take 6 months, during which you're uninsured, hoping nothing goes wrong. And if something goes wrong, you're destroyed. This ties you to your employer. You want to quit, start a business, take a risk, but you can't. You need the insurance. Your child has a chronic condition, requires ongoing treatment, ongoing medication. You're locked into your job, can't leave, can't take a better opportunity that doesn't provide insurance. The employer-based insurance system creates wage slavery, locks workers into jobs they hate, prevents entrepreneurship, prevents risk-taking, all to maintain access to health care. This isn't a benefit, this is a control mechanism, and employers are dropping coverage. The cost is too high. They're shifting to high deductible plans, covering less, charging more. The employee contribution increases every year. The deductible increases. The out-of-pocket maximum increases. The coverage decreases. You're paying more for less every year, and you can't do anything about it. The machine extracts more each year while providing less. Textbook extraction. Let me show you the international comparison, because understanding how other countries handle healthcare reveals how broken the American system is. Every developed country except the United States has universal healthcare, single payer or heavily regulated multi-payer. Everyone has coverage, nobody goes bankrupt from medical bills. Healthcare is a right, not a privilege tied to employment. Germany, everyone has insurance, mandatory, heavily regulated. Costs about 8% of GDP. The US spends 18% of GDP. Germany spends less than half per capita and covers everyone, with better outcomes, lower infant mortality, higher life expectancy, better satisfaction. How? By removing the profit motive, by regulating prices, by negotiating drug costs, by making healthcare about health rather than profit. The United Kingdom, NHS, National Health Service, free at point of use, funded through taxes, covers everyone, costs 10% of GDP. Life expectancy is higher than the US, infant mortality is lower, and nobody goes bankrupt from medical bills. Medical bankruptcy doesn't exist as a concept. The idea is absurd to them. How can you go bankrupt from healthcare? Healthcare is free. The government provides it. You pay taxes, you get care. Simple, humane, civilized.
but Americans are told that socialized medicine is terrible. Long wait times, rationed care, government death panels, all propaganda. The wait times in the UK are shorter than in the US for most procedures. The care quality is equal or better, and the cost is half. Americans wait months to see specialists, wait hours in emergency rooms, get denied treatments by insurance companies. All the problems we're told socialized medicine would create already exist in the US system. Except in the US, you also go bankrupt. The propaganda serves the machine, keeps Americans from demanding universal health care, keeps the profit flowing, keeps the extraction running. The insurance companies spend billions on lobbying, on campaign contributions, on propaganda, all to prevent universal health care, because universal health care would end their business model, would end the extraction, would end the machine. Can't have that. Let me show you the life expectancy dimension. The US spends more on healthcare per capita than any country in the world, 12,000 per person per year, total of 4.5 trillion annually. That's 18% of GDP. And what do Americans get for that spending? The worst health outcomes in the developed world. Life expectancy in the US is 76.4 years. That's lower than every other developed country. Japan is 84, Switzerland is 84, Australia is 83, Canada is 82, the UK is 81. All of these countries spend half what the US spends, and their people live 5 to 8 years longer. Americans are dying younger despite spending more. The machine is extracting more and delivering less. Textbook failure. Infant mortality in the US is 5.4 per 1,000 live births. That's twice the rate of Japan, Finland, and Norway. Maternal mortality is 23.8 per 100,000 live births. That's 3 times the rate of Germany and 4 times the rate of the UK. American women die in childbirth at rates comparable to developing countries, while spending $12,000 per person per year on health care. The money isn't going to care, it's going to profit to executives, to shareholders, to the machine. And health outcomes vary dramatically by income and race. Rich Americans live as long as people in other developed countries. Poor Americans die at rates comparable to people in developing countries. White Americans have lower infant mortality than Black Americans by a factor of 2. Black women die in childbirth at 3 times the rate of white women. The healthcare system is segregated by income and race, provides first world care to the rich and third world care to the poor. This is structural violence, killing poor people and minorities through unequal access and unequal treatment. And it's legal, it's standard, it's the machine operating as designed. Now, let's talk about the moral dimension, because this isn't just about money, it's about values, about what kind of society we are. Every developed country treats healthcare as a human right. The US treats it as a commodity, a product, something you buy if you can afford it. And if you can't afford it, you suffer or die. That's the American system. That's the American value structure. Profit over people, money over life, extraction over care. Sarah Mitchell did everything right, worked full time, had insurance, paid premiums, and when she got cancer, the system destroyed her, bankrupted her, took her house, took her savings, took her security, for having cancer, for getting sick, for being human. This is barbaric. This is evil. And it's defended as freedom, as market efficiency, as the American way. The American way is letting 45,000 people die per year because they don't have health insurance. The American way is forcing 530,000 families per year into bankruptcy due to medical bills.
The American way is making insulin cost $300 per vial, so diabetics die rationing it. The American way is denying cancer treatments because they're too expensive. The American way is sacrificing human life and human dignity on the altar of corporate profit. That's the value statement. That's what we choose every day, every policy, every election. We choose the machine, we choose extraction, we choose death. And the people who defend this system are mostly healthy, mostly wealthy, mostly insulated from its worst effects. They have good insurance, can afford the out of pocket costs, can access the best care. They're fine. So they defend the system, tell everyone else to work harder, to make better choices, to take personal responsibility. But when they get sick, when they face a serious illness, some of them change their minds. Some realize the system is broken, that it doesn't work, that it's cruel and unjust and indefensible. But by then, it's often too late. They've already voted to maintain it.
Already lobbied to preserve it, already benefited from it at others' expense. Let me show you the future, because it's getting worse. Healthcare costs increase faster than wages every year. Insurance premiums increase 7 to 10% annually. Wages increase 2 to 3%. The gap widens. More people are priced out. More people go uninsured. More people delay care. More people die, and the machine gets more profitable. Insurance company profits are at record highs. United Health made $23 billion in profit in T4. Anthem made $6 billion. Cigna made $5 billion. These are some of the most profitable companies in America, extracting billions from sick people, denying claims, limiting coverage, and reporting record profits to shareholders. The machine is working beautifully for the machine, for the shareholders, for the executives, not for the patients, not for the sick, not for the dying. And consolidation continues. Hospitals merge, insurance companies merge, pharmaceutical companies merge. Vertical integration, horizontal integration. The machine becomes larger, more powerful, more entrenched, harder to reform, harder to challenge. The lobbyists grow more powerful. The campaign contributions grow larger. The propaganda grows more sophisticated, and reform becomes impossible. The machine is too big, too powerful, too profitable. It will never be reformed from within. It will collapse eventually. When enough people die, when enough families are destroyed, when the contradictions become unbearable. But that might take decades, and millions more will suffer and die before it happens. In the meantime, you're one diagnosis away from financial ruin. You're healthy today, have insurance, think you're protected, but you're not. You're one cancer diagnosis from bankruptcy, one heart attack from losing your house, one chronic illness from a lifetime of medical debt. The insurance you pay for won't protect you, won't save you, won't do what you think it does. It will collect your premiums, deny your claims, extract as much as possible while providing as little as necessary. That's the business model, that's the machine, and you're the fuel. Sarah Mitchell survived cancer, but lost everything. She's alive, working again, renting an apartment, rebuilding slowly, but she'll never recover fully, never get back what she lost, never feel secure again, because she knows the truth now, knows the machine will destroy her if she gets sick again, knows there's no protection, no safety net, no security, just the machine, waiting to extract, waiting to profit from suffering, waiting for the next victim. This is the healthcare bankruptcy machine. This is how insurance companies profit from your death and your suffering. This is how the wealthiest country in the world created the cruelest healthcare system in the developed world. This is how 30,000 families per year are destroyed financially for the crime of getting sick. And this is why you should be terrified, because you're next. You just don't know it yet. The machine is waiting. The premiums are due, the deductibles are set, the claims will be denied, and when you get sick, when you need care, when you face the moment Sarah Mitchell faced, you'll learn what she learned. That the system isn't designed to help you. It's designed to extract from you, to profit from your suffering, to bankrupt you, to destroy you. That's not a bug. That's the feature. That's the machine working exactly as designed. They sold you insurance, they gave you a bankruptcy machine, and they're profiting from your death.